Health coverage was always a big concern. I was a single parent for about 7 years and covering 2 boys.
It is no longer a worry for almost 350,000 previously uninsured people in Michigan now signed up for health insurance under the Affordable Care Act. The law requiring every American to have health coverage was signed by President Obama nearly 6 years ago amid a firestorm of political controversy. It's been 2 years since the insurance marketplaces went online. In this special report, 9 and 10's Adam Bartlemay has a look at how it's affecting healthcare providers, insurers, and people right here in northern Michigan in 2016.
I was able to match my coverage that I had previously with my employer.
Carrie Stone from Kewadin is one of the hundreds of thousands of people in Michigan who are now insured under the Affordable Care Act. She had a job where she had coverage, but she decided to leave and branch out on her own, leaving her without.
It really made sense to me to leave my employer after looking at the healthcare costs being so comparable to what I was paying before and also having the same kind of coverage.
According to healthinsurance.org, Carrie has a lot of company among those in Michigan now insured under the ACA. A little more than 341,000 signed up for coverage in 2015. 42% of them were new to the marketplace.
We've been averaging about 1,500 new patients a year for the last couple of years for sure.
Dr. J. William Rollin is the director of the Munson Family Practice Residency. He says now that more people are insured, they're coming in for preventative care, which could help keep costs down.
Prevention is the key, so still encouraging people to try to get that preventative health care to try to keep them well, because in the long run that's going to help our overall healthcare industry.
It's already helped Munson Healthcare in terms of the number of people who owe them for care they couldn't pay for.
This is the 3rd year in a row for Munson Healthcare that we've seen our bad debt and charity care go down.
It's gone down, but it hasn't been eliminated. Margot Francisco is the vice president of planning for Munson Healthcare. She says many people opt for the cheapest plans on the exchange, and that means higher deductibles.
If you've got let's say a $5,000 deductible, that's a lot of money for the average individual, let alone family in northern Michigan. So there is a concern that can people afford these plans?
Jen Seaman, senior manager for insurance provider Priority Health in Traverse City, says education is key when deciding what plan you need. According to the Department of Health and Human Services, 88% of people in Michigan who signed up in 2015 qualified for assistance based on income.
If the individual is eligible for subsidies, the cost of the plan could go down for them. So what one plan costs one family for might not cost another family for the same amount.
Despite available subsidies, the cost may be too high. Dr. Rollin thinks that's why some people opt to pay the fine.
And they look at that as being even probably a less costly option for them to just pay the penalty than to actually have to go through and get the insurance and all the potential costs that may still come with that.
As with anything, the ACA has its pros and cons. For Munson, one of the positives is more cooperation in the medical community.
We see the hospital providers and the outpatient providers working together in a way that they didn't before, so that we can again try to deliver care at the right place at the right time for each patient, which usually means that's the lowest cost setting.
As for Carrie Stone, she was able to get a subsidy and a lower deductible. There was something else she found that helped one of her kids who has several health issues.
He was able to qualify for Medicare through the Affordable Care Act, and his coverage through Medicare could be way better than I could provide him.
In Traverse City, Adam Bartlemay for 9 and 10 News.